My name is Edie. I've been a registered nurse for approximately 30 years. The majority of my nursing, I've worked in a level 1 trauma center. In a busy ER session where we would see approximately 245 patients in a day. One particular night, we had a medical team activate, and I worked side by side with this nurse who was 25 years in nursing. She was a very expertise nurse. She prided herself in using universal precautions. While I was preparing the IV lines, the NG, and the Foley catheters, she started the IV catheter, and she placed an 18-gauge bore and a cubital site. This patient was combative, but she did the proper technique of holding digital pressure. All the meantime, the patient's moving around. She had to apply the vacutainer, collect 9-10 tubes of blood. She then had to remove the vacutainer again, and again the patient is combative. Droplets of blood were coming out on a 4x4 sponge, which is not unusual for us nurses to apply. She then inserted the IV line. We stabilized the patient, very busy particular shift. Everything was tidy in the room. She and I both looked at that room, and as we walked out, she noticed a 4x4 sponge laying next to the patient's IV site. She immediately picked it up after she had removed her gloves, and she immediately noticed what she had done, because the night before she had cut herself on her plantar surface of the inside of her thumb while she was preparing dinner for her and her family. She really didn't think anything of it. She quickly, thoroughly washed her hands, thought it would be okay, a little alarmed. She didn't say anything to me at that time. Afterwards, we went back to the nurse's station. We looked at the history and physical part of the chart, and we noticed that patient had AIDS. Unfortunately, most of our emergency patients that we see do not tell us they have AIDS. They do not tell us they have hepatitis. They do not tell us they have MRSA or tuberculosis. So we were concerned, but she thought certainly she washed her hands in plenty of time, very thoroughly, and put that aside. Approximately 2 weeks later, she acquired flu-like symptoms: runny nose, fever, rash, swollen lymph nodes, not feeling very well, and that subsided. Approximately 9 months later, she acquired 10 pounds, significant weight loss for no apparent reason. Again, lymph nodes, not feeling very well, fever, diarrhea. She and I talked about it. Didn't really think anything of it. Being in an emergency department, you think you have the flu. It's not unusual. We're exposed to all types of illnesses. We had the flu. She went to her physician, drew blood work. Nothing came out. Gave antibiotics. It didn't cure her. She went back to that case 9 months ago, and she asked her physician, "Doc, do a CD4 T-cell count on me." Well, she called me a few days later, and we were both crying on the phone. She had it. We think about, why didn't you tell me, Edie? Why didn't you stop me from grabbing that sponge? Why didn't you tell me to wear my gloves? You go back and you think, what if? What should I have done? But again, we are nurses. We help people. We take care of people. We didn't think about it. But I wore my gloves doing the IV. I started the IV, but the blood came out. I was trying to maintain that patient. I was stabilizing that patient. I was drawing my tubes of blood. I was starting my IV, but the blood came out on that little sponge. It wasn't a lot, just a few drops of blood. But it happened. Very devastating. She thinks back to this day, every day, had I done things differently. You know, she would love to be alive and see her children, her grandchildren, but she can't anymore. And she's living with a debilitating disease where there had been perhaps a device out there. Had there been a medical device out there, she probably, I can almost guarantee you, those droplets of blood may not have come out. And she'd be living today and living to see her children, her grandchildren, and still be working as a nurse in a career that she loved and took pride in. And she is a great ER emergency nurse. And she made I think what's so important, I think that keeps her going, that she has made an impact in her career, that part of it, I think that keeps her strong in her her illness now, that she's made a difference. She's made an impact of life. She saved lives. She's dying, but she saved lives. And when I asked her about this, I said, "Can I tell your story?" And tears came into her face, and she said she did not want me to identify her, but she said, "Please, Edie, tell my story to those young nurses. Tell my story, because perhaps my story will save one nurse. We're a team. We nurses are a team." So I'm really, I appreciate you inviting me here to tell my story, that perhaps we can tell a difference and we can reach out to one nurse, that she'll think differently.